In this video, I am going to show you 3 ways that chemotherapy is helping people with mesothelioma. Not only can it help you live longer, but it can also improve your quality of life. It's a fascinating topic, and there's been some really exciting research in recent years that I'm going to share with you here. Hi, I'm Deborah from SurvivingMesothelioma.com, and for almost 20 years, we have been helping mesothelioma patients with the latest mesothelioma information. In today's video, we are going to look at how chemotherapy may be able to help mesothelioma patients. First off, let's talk about what chemotherapy actually does. Think of it like sending an army of tiny soldiers into your body to fight those fast-growing cancer cells. These chemo drugs are pretty clever. They have a few different ways of attacking the cancer. One of the main things that they do is mess with the cancer cell's ability to divide. You know how cancer cells are always multiplying out of control? Well, chemo is designed to put a stop to that. It's like saying, hold up, not so fast, and just interrupting the whole process. Then there is this thing called apoptosis. It is basically a self-destruct button for cells. Chemo drugs can flip the switch in cancer cells, making them just destroy themselves. Pretty cool, right? Some chemo drugs even stop cancer cells from making the proteins that they need to survive. It's like cutting off their food supply. The most common chemotherapy combo for mesothelioma are 2 drugs, and they're called pemetrexed and cisplatin. And they work together to shrink tumors and help people live longer. Now, let's look at some of the research that shows how effective this can be. A big study from 2015, published in Clinical Epidemiology, looked at mesothelioma patients across the entire United States. And they found that chemotherapy, especially when they combine drugs like cisplatin or carboplatin with pemetrexed, actually helps people live longer. So researchers are always looking for ways to make chemotherapy even more effective. A review article from 2015 in Lung Cancer Management talked about combining standard chemo drugs with a new agent called Bevacizumab. And the results, they were impressive. People not only lived longer, but they also had a better quality of life. It's like getting a double benefit from one treatment approach. Now, you might be wondering, how do doctors decide which treatment to use? Well, it's not a one-size-fits-all approach. When someone is diagnosed with mesothelioma, doctors need to figure out exactly what they're dealing with, the cell type, what stage they're in, how far the cancer has spread, and that kind of thing. And doctors use all sorts of scans and tests for this. Once they know what's going on, they come up with a battle plan. And this might be chemotherapy by itself, or it might combine it with surgery, with radiation, or even immunotherapy. So using combinations of treatments like this often show improved survival rates in the studies that we've seen. Now, when it is time for treatment, you will usually get the chemo through an IV, and it goes in cycles. So you get the drugs, and then you get a break to just let your body recover, and then you do it again. This goes on for a while, and the whole time, doctors really keep a close eye on how you're doing. If you're having too many side effects, they might, change things up a little bit. Speaking of side effects, a study from 2008 published in The Lancet found that when they combined chemotherapy with what they call active symptom control, which is basically aggressive management of symptoms, there was a trend towards improved survival. And this really highlights the importance of a comprehensive approach to care, treating not just the cancer, but also making sure the patient is comfortable and their symptoms are well managed. Now here's where it gets really exciting. Okay, researchers are looking at ways to combine chemotherapy with other cutting-edge treatments. For example, in 2015, researchers explored the idea of combining chemotherapy with immunotherapy. Immunotherapy is this innovative approach where drugs are used to help your own immune system recognize and fight the cancer. The researchers found that this combination could potentially improve the immune response and lead to better survival rates. So, what's the current standard of care with all of these new approaches? Well, a 2020 guideline published in Clinical and Translational Oncology in 2021 confirmed that platinum-based chemotherapy such as cisplatin with pemetrexed is still the go-to treatment. It continues to show improvements in survival, which is why it remains the backbone of mesothelioma chemotherapy. The bottom line is this: chemotherapy is playing a role in the fight against mesothelioma. It is helping some people live longer, and when combined with other treatments, it's also helping them live better. And exciting new combinations with immunotherapy and other approaches are showing a lot of promise. Perhaps the most exciting thing is that this field is constantly evolving. Researchers are always looking for new ways to improve treatment, whether that is by fine-tuning existing approaches or exploring completely new ones. Every study, every clinical trial brings us one step closer to better outcomes for people with mesothelioma. So there you have it. That is the scoop on how chemotherapy is making a difference for people with mesothelioma. If you found this video useful, please share it with your loved ones. And if you're looking for more mesothelioma information, please visit survivingmesothelioma.com to see how Paul became the longest living mesothelioma survivor in the world.